I know we all have something like this in our homes. So there's a tablet envelope that contains a lot of medications. So let's see. So these are unfinished tablets of paracetamol, certain multivitamins, some antihistamines, a whole lot of things. I know everyone has at least something like this. Some people they even have a whole pharmacy shop under their bed or maybe in their wardrobe or somewhere because maybe they are on a lot of medications. Now, my question to everyone is simple. When you keep all these medications scattered together in a cluster or in a box like that, how do you sort these medications out? Especially you who is not even a health personnel. If you have a child, if you have maybe someone who has a chronic condition, let's say your grandmother, your auntie, your mother, your father is hypertensive, and his medications are scattered among even these medications. How do you expect this person to have a good therapeutic response to the medications? What the mere for your drink also. You might be having, let's say, anti-diabetics from different companies of the same class in the same box. So the person knows that oh, I have to take one tablet. The person will be taking one tablet of each. If there's an emergency, someone might even go and pick an expired, unfinished paracetamol because it's in that box. Now, to even the mothers, some people have their fridge in the kitchen containing unfinished doses of anti-malaria antibiotics because their child had some infection. They took the medication instead of 4 days, they took it for 2 days. The child got better, they stopped, they kept the rest. I don't know what they're keeping it for. Are you going to add it to our soup one day or something? That's just by the way. But doing all these things is very dangerous and is very harmful and it leads to a lot of therapeutic failures and also overdoses and also even some kind of poisonous from these medications. So what should be done or what is the best thing that should be done? Number one, you have to make use of your pharmacists who are around you and also your pharmacies. Why am I saying this? You have to pick these medications to your pharmacist. Then the pharmacist will do what is called medication reconciliation. I know that English is big, but it means that your pharmacist will sort these medications into their classes, into pain medications, into antihypertensives, into these things. If there's someone with a chronic condition who is on a routine medication, your pharmacist will now reconcile the medications to the person's conditions. The ones which are not supposed to be taken or expired will be kept by your pharmacist and they can dispose it off very well for you. Now, also, the ones which might be needed but not now, the pharmacist will ziplock them and label them accordingly for easy identification. In that way, we keep our children safe, we keep our family safe, we keep our loved ones safe. This is what should be done by everyone. So, my dear, make use of a pharmacist, make use of your pharmacies around you. This is connected, Dr. Greg. I need you alive. So please, let's stop that practice. Hmm? I know some of us have opened pharmacies in our homes, but please, let's do things in the right way. Between a medication and a poison is the dose, and also if you take something that you do not need, you do not know the catastrophic effects that will come onto you. So stay safe out there, and let's make use of our pharmacists. This is Connected Dr. Greg. Stay tuned for my next video. Bye bye.